What's going on YouTube? I want to talk to you a little bit about flight nursing. A lot of people ask me about flight nursing in the military and how they can possibly get into it. Well, in order to be a flight nurse in the military, Air Force specifically, I'm in the Air National Guard. You definitely have to have a bachelor's degree. At this time, AD and prepared nurses are not allowed to be flight nurses. So you must have a bachelor's degree in nursing and be a registered nurse. You will need to have some experience. Usually, to be a flight nurse, critical care experience, your ICUs, your emergency departments, that kind of experience is what you're going to need, trauma related, in order to be a good candidate for selection. If you are so lucky to be selected, at that point in time, you go ahead and you'll attend commissioned officer training. That's when they teach you how to be an officer in the United States Air Force. All your customs, your courtesies, your military history, military bearing. You learn a lot of leadership skills. The next thing you do is you will have to attend flight nursing school. Flight nursing school is currently in Wright-Patterson, Ohio. This is where you learn aerospace physiology. You learn how everything works in the air, which is a big difference from how things are on the ground. You learn all your stresses of flight, things that are very critical when it comes to flight nursing. At this point in time, you graduate that, then you'll attend what's called FTU. FTU is when you learn all your flight aircraft specific requirements. It's how you learn the aircraft, learn how to configure aircraft to take patients. You also learn about aircraft emergencies, how to operate in these kind of environments when a fire may break out on the aircraft, or you may have a rapid decompression. What to do for yourself, the aircraft, as well as your patients. This is critical. When you get to the end of this phase, when you will have a check ride. A check ride is composed totally of an open book test, a closed book test, and you also have an emergency procedures examination. This is when an instructor would be with you and you run through every piece of equipment that you have medically. They throw scenarios at you. Your patient's doing this, your patient's doing that, and they really hammer you to make sure you know how to use a piece of equipment, specifics, whether it's battery life. They want to know everything and how to use it, correctly for the scenarios that they provide. Once you've finished that part, you have the final portion, which is your actual check ride itself on the aircraft. Basically, it's a full mission from start to finish. It starts from your crew briefing to your loading and checking your equipment, to receiving patients, to they'll run aircraft emergencies, they'll run medical scenario emergencies. They'll throw a slew of things at you to make sure you are safe and qualified to fly. Once you completed that portion of training, you'll go back to your home station, and usually there is more follow-on training. This could be usually a few months where you actually learn specifics to your local policies, because you will have a specific primary airframe, even though we are qualified on all our cargo aircraft. So this period, you usually take place with an instructor and have training flights until you're good to go. They feel comfortable with you taking over and being a qualified flight nurse. Flight nurses can really have two roles on the aircraft. Primary roles, second flight nurse, as well as a MCD or medical crew director. The second flight nurse performs most of the patient care duties. They usually run the codes, things of that nature. Your MCD has total oversight and control over the entire medical crew. They handle all the paperwork and all the communication between the pilot, as well as if any phone patches need to be made to flight surgeons. Those are the primary two positions a nurse will hold for a medical mission. I just want to give a couple of insights into flight nursing. I've pretty much just touched the surface, but if you have any questions, comments, concerns, please don't hesitate, and don't forget to like and subscribe. Thanks.